Welcome to YourForState.com's Medical Corner. I'm Lynn Lawson. Right now we're joined by Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute, and he's our specialist on foot and ankle conditions. Nice to have you, Dr. Michaels.
Thank you, Lynn.
And our first question for you, what are hammer toes?
Well, hammer toes are curled toes. When your toe usually is straight, the hammer toe looks something like this. And that can be very painful for some people, especially when the toe is so bent where the top of the toe hits the top of the shoe. Then you get a callus, you get redness, you can even get a sore on top of your toe, and that can be a real problem for you. So basically, hammer toes are curled toes. They're not straight. They're kind of curled like that. They're hammered. And it's caused by many different things. Sometimes the tendons on the bottom are too tight, and that curls your toe. Sometimes the tendons on the top are not acting correctly, and that curls your toe. Sometimes your bone right here is too long, and that causes damage to some of the tissue underneath here, and that causes your toe to curl as well.
And how do you treat hammer toes?
Well, like with everything, hammer toes are treated with conservative and surgical care. So you want to try treating things first conservatively. So initially for a hammer toe, we'd recommend a shoe with a thicker toe box. So the toe box is a bit thicker. This isn't always readily available, but we have available shoe stores that are available for you to have, they house these shoes. In addition to that, there are gel toe crest pads that can be used. And a gel toe crest pad is like a silicone ring that goes around the toe, and then it has a pad that goes underneath all four lesser toes, not your big toe, but all four lesser toes. And that lifts up the toes and allows them to be straight. So you wear that inside your shoe. But again, that's not a fix. That's just an accommodation so you don't have pain with the hammer toe. If that doesn't work well enough for you, then surgery may be indicated. And there are several different types of surgery that can be done. All of it is outpatient. All of it is same day. Usually you can walk this, right out of the OR when you're done with it. And that straightens out the toe. Sometimes we have to take out, with the surgery, a joint and put an implant in, like a small wire, to hold the toe straight while the toe heals. Sometimes all we have to do is take out a little piece of bone, but you'd have to come in and be seen, and we'd have to figure out the exact plan for your foot. Again, though, you want to try the conservative treatment first to treat a hammer toe. Wider shoes, thicker shoes, the gel toe crest pad, and then if that doesn't work and it doesn't give you the results that you want, then you move on and do something more invasive. There are even procedures that can be done that are done in the office, and you don't have to go into the hospital or the surgery center. They can be done right in the exam chair with one stitch. And that's kind of a nice procedure if you have the kind of hammer toe that would be fixed by that procedure. But oftentimes, people get better and their pain goes away with conservative care, so surgery isn't always needed.
Thanks so much, Dr. Michaels. Again, that was Dr. Dan Michaels of the Reconstructive Foot and Ankle Institute. And don't forget, you can find more information on foot and ankle conditions only here on YourForState.com.